Nursing home versus assisted living. Three main types of facilities. With a rapidly aging population, families need to plan how they will house and care for the seniors in the future. For example, people who require help full-time might move to a residential facility that provides many or all of the long-term care services they need. In addition to housing, personal and medical care for seniors is another pressing issue, with massive potential for growth in the coming years. There are mainly three types: nursing homes, assisted living homes, and retirement homes. Nursing homes. Nursing homes, also called skilled nursing facilities, provide a wide range of health and personal care services. Nursing homes focus on medical care. These services typically include nursing care, 24-hour supervision, 3 meals a day, and assistance with everyday activities. Rehabilitation services, such as physical, occupational, and speech therapy, are also available. Nursing homes increasingly offer medical services similar to those offered in hospitals after surgery, illness, or other sudden medical problems. Older adults need a higher level of care, and hospital stays are shorter than they used to be. Medical services vary a lot among nursing homes, but usually include skilled nursing care, orthopedic care, care for muscle, joint, and bone problems, breathing treatments, support after surgery, physical, occupational, and speech therapy, intravenous therapy and antibiotics, wound care. Nursing care and skills. A nurse in a nursing home facility has many responsibilities. First, they have the task of caring for elderly residents. They are also in charge of other employees and have to make sure the operation runs smoothly. Caring for the elderly in a nursing home is a huge responsibility, as many residents usually need some type of medical attention. Nurses in nursing homes need a different skill set than nurses in a hospital or clinic. These specialized skills allow them to concentrate their care to the needs of their residents. Some of the skills needed include patient care, home health, treatment planning, case management, hospice, patient/family education, acute care, medication administration, advanced cardiac life support, ACLS, and patient evaluation. Patients with physical disabilities. Some type of disability when it comes to performing the activities of daily living, ADLs, is the most common reason that older people live in nursing homes. Not surprisingly, people living in nursing homes generally have more disability than people living at home. Over 80% of nursing home residents need help with 3 or more ADLs, such as dressing and bathing. About 90% of residents who are able to walk need assistance or supervision. More than half of residents have incontinence, the inability to control bowels or the bladder, and more than a third have difficulty with hearing or seeing. In addition to physical problems, mental conditions are common in nursing home residents. In fact, dementia remains the most common problem, and affects an estimated 50 to 70% of residents. More than 3/4 of nursing home residents have problems making daily decisions, and 2/3 have problems with memory or knowing where they are from time to time. Medical and clinical care. A nursing home facility may be the best choice for people who require 24-hour medical care and supervision. Nursing homes offer the most extensive care a person can get outside a hospital. Nursing homes offer help with custodial care, like bathing, getting dressed, and eating, as well as skilled care. Skilled nursing care is given by a registered nurse and includes medical monitoring and treatments. Insurance covers the cost. Payment for nursing home care can be made through Medicare, Medicaid, private insurance, and personal funds. Medicare is a federal health insurance program providing health care benefits to all Americans age 65 and over. Insurance protection intended to cover major hospital care is provided without regard to income. Medicare will only provide 100 days of nursing care, and only if a person requires skilled care and is referred by a doctor when discharged from the hospital. If a person needs custodial care alone, Medicare won't cover it. Medicare only pays for skilled care in a nursing facility that has a Medicare license. Medicaid is a joint federal/state health insurance program providing medical care benefits to low-income Americans who meet certain requirements. Nursing home care is covered through Medicaid, but the requirements and covered services vary widely from state to state. To become eligible for Medicaid coverage, people usually have to spend all of their assets first. This means that they might pay for nursing home care out of pocket initially. Once their money runs out, Medicaid would kick in. It's a good idea to work with a lawyer who specializes in elder law when determining Medicaid eligibility. Private long-term care insurance is a health insurance option that, if purchased, supplements Medicare coverage. Private long-term care insurance policies vary greatly. Each policy has its own eligibility requirements, restrictions, costs, and benefits. Progressive medical needs. Progressive medical needs refers to care provided to nursing home patients who need more monitoring and assessment than other patients but whose conditions aren't so unstable that they need to be in the hospital. These patients are often on multiple medications and are at an increased risk for complications. Nurses monitor critical vital signs, detect any changes, and initiate life-saving interventions if needed. Medical equipment. Nursing home residents are significantly more likely than other people to go to the hospital. These hospital stays can be disruptive and frightening, especially for people with dementia. The right nursing home medical equipment can manage a number of minor medical conditions, preventing them from getting worse and reducing the need to transport residents to the hospital. Having the right supplies on hand is an important component of nursing home emergency preparedness, so most nursing homes will have the following supplies. Safety supplies. Nursing home residents may fall, wander, or have mobility impairments. Most facilities will have walkers, wheelchairs, crutches, braces, bed alarms, shower seats, and patient call systems. First aid items. Many minor injuries are safe to treat at the nursing home, without transporting the patient. Most nursing home facilities have a large first aid kit fully stocked with disinfectants, gloves, bandages, burn medication, and basic medications for pain and other maladies. Patient medical supplies. Most facilities will also have catheters, urinary bags, bedbands, and similar items. Treating patients with specialized needs might require other items as well, such as sensory blankets for dementia patients. The facility should also have a supply of each patient's prescription medication. Most facilities also will have an emergency defibrillator. Lifts. When patients cannot move well, they may need assistance. Nursing homes generally have bed lifts, support structures, and stretchers to help move patients when they need care. Assessment tools. Every nursing home must be prepared to assess its residents for signs of common illnesses and monitor changes in a patient's status. They will have the following tools on hand: stethoscope, otoscope, pulse oximeter, thermometer, blood pressure cuff, and a scale. Infection prevention. Infections can travel like wildfire through a nursing home, particularly when staff do not take appropriate infection prevention precautions. There's no such thing as too many infection prevention supplies, particularly in a post-COVID world. In an effort to mitigate infections, nursing homes will have disinfecting wipes, personal protective equipment including surgical masks, N95 masks, goggles, face shields, and aprons, hand sanitizer, and hand soap. Mental and cognitive health support. Mental and cognitive health directly affect physical health and patient well-being. Nursing homes usually have a diverse supply of items to keep patients' minds and bodies occupied, including books, CDs, and movies, tablets, computers, games and exercise equipment, including equipment for bedridden patients. CNA and GNAs. Certified Nursing Assistant, CNA. A person trained and certified to assist individuals with non-clinical tasks such as eating, walking, and personal care. In a hospital or nursing home, the person may be called a nursing assistant, a personal care assistant, or an aide. Some of the basic tasks a CNA might do are: changes bed sheets, bathe patients, change bedpans, feed patients, walk the patient, helps with personal hygiene, transport patients, and any other tasks that are designated by the LPN or RN. Geriatric Nursing Assistant, GNA. A GNA is a geriatric nursing assistant that assists patients with daily activities in a nursing home under the supervision of a registered nurse, RN. Although daily duties can vary by employer, this normally includes dressing, bathing, feeding, and taking vitals of the patients. What is the difference between CNA and GNA? A certified nursing assistant, CNA, works in an assisted living facility or for an agency. A geriatric nursing assistant, GNA, works for a nursing home. The only difference is the type of employer they can work for. The skills needed to be a CNA or GNA are the same. Facility size. Publicly owned facilities are the largest with an average of 61 beds. Skilled nursing homes under proprietary ownership average 24 beds. Homes connected with church groups average 50 beds while other types of nonprofit homes average 39 beds. Approximately 87% of the skilled nursing homes are owned by proprietary interests. However, while proprietary homes account for nearly 9 out of 10 homes, they provide little more than 7 out of 10 beds. Types of staff. Federal law states certain staffing requirements for all nursing homes. The main requirement is that the nursing home has sufficient staff members to ensure proper care for all residents. However, there is no specific required number of staff members present during different times of the day. One registered nurse, RN, is required to be on duty for a minimum of 8 hours a day, 7 days a week. Additionally, either an RN or licensed practical or vocational nurse, LPN/LVN, should be on duty 24 hours a day. Some states have additional requirements for nursing home staffing. Nurses. Registered nurses, RNs, are required by law to assess the needs of nursing home residents. Once assessed, the RNs work with the licensed vocational nurses, LVNs, and licensed practical nurses, LPNs, to plan and implement the residents' care and treatment. Nursing assistants. Certified nursing assistants, CNAs, work under licensed nurses. CNAs typically assist with maintaining health and well-being in terms of daily activities. They help residents with tasks such as eating, hygiene, grooming, dressing, and using the bathroom. Nursing home dietitian. Federal nursing home laws require every nursing home to have a qualified dietitian who works for the facility full-time, part-time, or as a consultant. Medication administration. Nurses must ensure medication safety in respect to the storage of medications, the checking for expiration dates, checking for any patient allergies, and checking for any incompatibilities. Nurses must use at least two unique identifiers, other than room number, prior to all procedures including the administration of medications. Some examples of unique identifiers include the client's first, middle and last name, a unique password or code number assigned to that person upon admission, the client's complete birthday in terms of the month, the day and the year, a photograph, and an encoded barcode containing two or more unique identifiers. Narcotics must be locked and secured in a safe place. Other medications must be stored in a place that is secure and one that prevents accidental poisonings among the pediatric population and also among those who are confused and or cognitively impaired. Additionally, medications that need refrigeration must be refrigerated. Assisted living homes. Assisted living is for people who need help with daily care, but not as much help as a nursing home provides. Assisted living facilities provide housing and supportive services, supervision, personalized assistance, health-related services, or a combination of these services to meet the needs of individuals who are unable to perform, or who need assistance in performing, the activities of daily living or instrumental activities of daily living. Assisted living residents usually live in their own apartments or rooms and share common areas. They have access to many services, including up to 3 meals a day, assistance with personal care, help with medications, housekeeping, and laundry, 24-hour supervision, security, and on-site staff, and social and recreational activities. Assistance with daily living, ADL. Activities of daily living are common tasks we all do to live an independent life. ADLs cannot be avoided or skipped without affecting health and safety. They directly tie to one's independence. Activities of daily living or ADLs consist of self-care tasks. One way to think about it is that they are the things people do when they get up in the morning and get ready to leave their house. Get into/out of bed or chair. Toilet hygiene. Bathing or showering. Getting dressed. Personal hygiene. Eating. Walking, climbing stairs. Safety/emergency responses. Personal care, in home-like setting. Personal care provides, in addition to room and board, personal services such as help in walking and getting in and out of bed, assistance with bathing, dressing, and feeding, preparation of a special diet, and supervision over medications which can be self-administered. Residential care Provides primarily room and board with limited services such as laundry, personal courtesies such as occasional help with correspondence or shopping, and a helping hand short of routine provision of personal care described above. Paid out of pocket. For the average American living off of retirement funds, pensions, 401ks and company stock returns simply aren't an option anymore. Depending on the needs, age, current medical coverage, income, and/or eligibility for state, government or local programs, a senior may find themselves needing to self-pay for part or even all of their senior living expenses or home care costs. Paying for assisted living entirely out of pocket is often referred to as private pay. This essentially means that the resident will be assisted living in advance, planning for costs using personal finances or assets to pay for all of the care and services. Keep in mind that people who are able to pay for care with insurance are also considered private pay, since this is not a payment that uses governmental sources or programs. Caregivers. In assisted living, it's the certified nursing assistants, or CNAs, orderlies and medical attendants who provide the day-to-day personal care to the residents. Each resident has different needs and will require different levels of care. For those seniors in good health that do not require much, if any, medical assistance, there is no need for a skilled nurse. For others, having accessible physical therapy might be a requirement. Some general titles of staff that might be found at the larger assisted living facilities include Administrator, the director of the facility. Medical Director, in charge of the overall healthcare strategy. Director of Nursing, responsible for overseeing all nursing activities. Admissions Coordinator, responsible for resident admissions. Housekeeping Coordinator, responsible for all housekeeping activities. Dining Coordinator, responsible for all dining activities. Nursing staff may include registered nurses, licensed practical nurses, clinical nursing assistants and personal care technicians. Housekeeping staff. Custodial staff. Dining staff. Administrative staff. Volunteers. Smaller setting/facility. The services and intermittent medical care that are often provided can make assisted living a viable option for more seniors than ever before. Since assisted living maximizes quality of life and provides a more independent lifestyle, it's often preferred over nursing home care when possible. Requirements for classification as a small assisted living facility were that between 4 and 25 beds were offered. Large facilities offered between 26 and 50 beds, with some even larger, holding over 50 beds. Smaller facilities outnumber larger ones by almost twice as much. Retirement home. A retirement home, simply explained, is any privately owned facility designed to accommodate individuals in their senior years. Retirement homes cater to people who are independent but want to be able to access care and support if they need it. It's intended for those wishing to maintain their lifestyles while also experiencing on-site support and care. A retirement home is far more than a collection of walls and windows. It stands as the next chapter for seniors, offering them greater control over both their lifestyles and their needs. Senior living environment. Most retirement facilities offer a wide range of different activities and social events tailored to your needs and interests, from sports and fitness programs to gardening, book clubs, cards, arts and crafts, and adult education classes. Many older adults find that they're actually more active and social when they move to an independent living facility, helping them feel healthier, happier, and less isolated. Independent living facilities usually have 24-hour staff who can quickly and easily provide help if you ever need it. No care is needed. Residents of the retirement home are mostly independent, which means that the older adults who live in these communities are not receiving any assistance by the way of medical more than routine doctor visits, meaning that if assistance is needed, it is not provided for by the community entity itself. What is special about these communities is that neighbors often look in on one another. These communities can be really happening and thriving places to live. Many of them have dining halls, recreation centers, exercise equipment, special interest groups, and social gatherings. Each retirement home community will have its own rules and regulations about their criteria for qualifying to live in their independent community. Independent living. Independent living is simply any housing arrangement designed exclusively for older adults, generally those aged 55 and over. Housing varies widely, from apartment-style living to single-family detached homes. In general, The housing is friendlier to aging adults, often being more compact, with easier navigation and no maintenance or yard work to worry about. While residents live independently, most communities offer amenities, activities, and services. Often, recreational centers or clubhouses are available on site to give you the opportunity to connect with peers and participate in community activities, such as arts and crafts, holiday gatherings, continuing education classes, or movie nights. Independent living facilities may also offer facilities such as a swimming pool, fitness center, tennis courts, even a golf course or other clubs and interest groups. Other services offered may include on-site spas, beauty and barber salons, daily meals, and basic housekeeping and laundry services. Since independent living facilities are aimed at older adults who need little or no assistance with activities of daily living, most do not offer medical care or nursing staff.